Moderna's coronavirus vaccine could soon be part of America's largest mass vaccination effort. The FDA says Moderna's vaccine is highly effective and says there are, quote, no specific safety concerns. A panel is expected to meet Thursday to consider the pharmaceutical company's application for emergency use. This comes as distribution ramps up for the Pfizer vaccine. Hundreds of hospitals started giving shots to doctors and nurses Tuesday. Meanwhile, healthcare systems are stretched thin as coronavirus infections skyrocket. More than 110,000 Americans are being treated for the virus in hospitals nationwide. The U.S. has confirmed more than 16.6 million cases total, and the death toll has climbed above 302,000. And on Capitol Hill, congressional leaders are still working on a coronavirus relief package. Senate Majority Leader Mitch McConnell vows they will not break for the holidays until a deal is reached. Mola Lenghi begins our coverage in New York City.
Tonight, a sign that vaccine reinforcements could be on the way. The FDA released new Moderna vaccine data ahead of the panel vote Thursday. The FDA says the vaccine overall is 94.5% effective. It's 100% effective in people 65 and older. Like the Pfizer vaccine, it's given in 2 doses, but Moderna's doses can be stored at normal refrigerator temperatures for 30 days. 6 million doses could go out as soon as the FDA gives the green light.
We were kind of starting off with just a 50% requirement. And when we saw that particular number, it was like fantastic.
This as frontline healthcare workers at another 425 hospitals began getting their shots of the Pfizer vaccine, including Dr. Umesh Gidwani. He and his fellow doctors and nurses at New York's Mount Sinai Hospital were overcome with emotion.
Is it hard to believe we've gotten here so quickly?
It is indeed remarkable. And it's a beautiful thing to see everyone's hopes realized, everyone's hard work rewarded.
5 vaccinations done.
It was the same scene from Chicago to Houston. But the COVID death toll is mounting. With more than 110,000 people hospitalized, 76% of the nation's ICUs full. In California, Governor Gavin Newsom is preparing for a surge in deaths.
53-foot refrigerated storage units are currently standing by now in counties and at hospitals. We just had to order 5,000 additional body bags.
In remembrance, bells at the National Cathedral in Washington, D.C. rang out 300 times to remember the 300,000 Americans who have lost their lives to the virus. Some remember all too well, like Dr. Gidwani, who in the early days of the pandemic kept a video diary of the daily emotional trauma.
What could we have done better? What could we have done different? Could we have saved another life?
But today, a new feeling, hope.
The hope is that this vaccine will finally extinguish this fire that's been raging.
Well, as vaccinations continue in places like Mount Sinai Hospital here in New York, health officials stress that we are not yet in the clear, that the virus continues to surge, partly due to asymptomatic spread. But some good news on that front. The FDA has authorized a COVID test that you can take at home, receive the results at home within 20 minutes, all without a prescription. And it's said to be 91% accurate, even among asymptomatic cases. Elaine?
Mola Lenghi, thank you. Health officials in nearly a dozen states say they don't have enough funds to effectively administer a coronavirus vaccine, continue testing, and conduct contact tracing. They tell CBS News they need billions of dollars from the federal government. Nancy Cordes reports.
In this 2-county swath of rural North Carolina, the money to fight COVID has all but run out.
We have no indication of future funding past December 30th.
Lisa Macon Harrison heads the local health department. She says her nurses are running on fumes after 9 months of testing and tracking cases, which have doubled since Thanksgiving.
And listen, I'll be calling you next week to check on you again. It's exponential.
And that's before they have to mount a campaign to inoculate 100,000 residents.
We need more people, and we need better technology, and we need infrastructure.
She likens Operation Warp Speed, the federal rollout of the vaccine, to a war effort that's leaving out a key component, public health departments like hers.
It's as if we've invested in those aircraft, but we're not willing to pay for the fuel to get them off the ground.
There are 3,000 local health departments across the country, and their funding from the first round of COVID relief expires at the end of this month, just when they're supposed to be ramping up.
So what's going to happen if you don't get that money?
I don't think that the vaccine distribution will happen as fast as it could.
We have done nothing since March 23rd.
Congress has been fighting over a new relief package for months. A bipartisan proposal released Monday would provide $16 billion for testing, tracing, and vaccine distribution. Pennsylvania alone says it needs hundreds of millions of dollars. Mississippi wants $17 million. And in Kentucky,
we're facing a funding cliff.
Kentucky is the home state of Senate Leader Mitch McConnell.
Many states, including your own, say they actually needed that vaccine money months ago so they could plan. How much longer are they going to have to wait?
Shouldn't have been put in this position. We should have done this a long time ago. We're not leaving until we finish this package.
He and the other top congressional leaders scheduled 2 in-person meetings to hash all this out on Tuesday, a sign that they may be getting closer to a deal not just on vaccine funding, but on money for schools, small businesses, the airlines, and other industries hard hit by COVID. Elaine?
Nancy Cordes, thank you. Dr. Richard Besser joins me now. He's the president and CEO of the Robert Wood Johnson Foundation. He's also the former acting director of the CDC. Dr. Besser, welcome. Thank you very much for being with us. As we just heard, many states don't have money to even administer the vaccine. If they don't get federal assistance in time, how big of a setback could this potentially be in the country's fight against the virus?
You know, Elaine, this is critical. Congress has totally dropped the ball. I serve on the New Jersey Restart and Recovery Commission and serve on the Regional Commission for the 7 northeastern states. And states are hurting. They're hurting in terms of their ability to distribute vaccine to people. They're hurting in terms of the ability to do outreach to people in communities to address people's concerns. They're being forced to make very tough decisions in terms of their funding. Schools need resources in terms of being safe places for students, teachers, and children. And having to decide between, well, do you put money into your schools? Do you put money into vaccine distribution? Do you put money into keeping people from being evicted? This is all because Congress has not done their job and provide the resources that states need, that people need, that businesses need.
Well, let's talk about this Moderna vaccine. We could soon see the FDA approve that vaccine by Moderna for emergency use. It would be the second coronavirus vaccine available to Americans. How significant will that be, and when could we start seeing cases potentially go down?
It's huge. Every time you see a vaccine that's approved, then that increases the number of people who can be protected. Clearly, vaccines are not going to get us through this winter. It's wearing masks, keeping apart, washing our hands. But in the long run, vaccines are a way out of this pandemic. And I reviewed the data that the FDA posted on their website. And I think it is very likely that the FDA Advisory Committee on Thursday will approve this vaccine. It looks to be safe, highly effective. And unlike the Pfizer vaccine, they were able to show some data that indicates that it could prevent people who don't have any symptoms from spreading it. And that's going to be a critical piece in terms of controlling the pandemic.
Well, there are still many Americans who are hesitant about vaccines, and you recently wrote that pressuring people to get the vaccine is not the answer. So how do healthcare professionals build trust in this vaccine?
Yeah, a lot has to do with respecting people's concerns. I'm a pediatrician, and I remember early in my practice, I would have some parents who would come in and say, I don't want to vaccinate my child. I'm concerned about that. And early on, I would say, you need to find another pediatrician. I changed and took a different approach and spent time listening, trying to understand people's concerns. And you're not going to change everyone's mind, but some people, if you give them information and you work with them, they'll come around. I think here what we're going to see is that as more people know friends and family members who've been vaccinated, the demand is going to increase dramatically. But again, states and localities need funds to do that outreach. in particular communities of color that have been experimented on historically, have been abused by experimentation by the public health system, have been mistreated and disrespected. You need to ensure that trusted individuals, whether they be clergy, local healthcare providers, community organizers, have the opportunity to reach people one-on-one, to address concerns and help people reach informed decisions about whether they want vaccines.
Well, as we heard earlier, the FDA has authorized the first rapid at-home coronavirus test. How important is that step in our fight against the virus?
You know, I think in the long term, if we're able to have tests that are cheap, that are effective, that are highly accurate, that we can use at home, you could imagine a time before everyone is fully vaccinated where you might be able to wake up in the morning, do a test, and determine whether you are infected or not. And if you're not, you can go off to work. Your kids can go off to school. That is another approach to this. So, you know, if there are at-home tests that are accurate, that are cheap, that may come into one of the strategies that public health uses to get people to work in a very safe way.
Doctor, I also want to ask you about something we're just learning about, this new variant of the coronavirus apparently spreading rapidly through southern England. Now, officials have identified key mutations in the strain. How big of a risk do coronavirus mutations pose? Could they render the current vaccines less effective?
You know, viruses are very tricky. They're constantly mutating. And you hear this, oh, there's a mutation in the virus, and it can sound very scary. It depends. You know, what I'm seeing on the reports, and it's going to be very important to see scientific reports published in scientific journals that are peer-reviewed. But what I'm seeing is it doesn't cause any more severe disease than the variant that was there before. It does represent a change. And what scientists will watch for is, well, what's changed in that virus? Both the Pfizer and the Moderna vaccines target what's called a spike protein, which is a particular protein on the surface of the virus. If that doesn't change, you wouldn't expect the vaccine to be any less effective. But one of the things that scientists always do when there's a new infectious agent is monitor it for changes, look to see, do they affect whether it spreads more easily or less easily? Does it make the disease any more or less severe? It's all part of the scientific process during an outbreak or the emergence of a new infectious agent.
Finally, Doctor, we are in the holiday season. Hanukkah is in full swing, Christmas 10 days away, and we'll be welcoming the new year in just over 2 weeks. This has been such a difficult year, and a lot of folks by now understand what the protocols are and that they should not gather. At the same time, this is that time of year when it can be easy to let your guard down. What would your guidance be to people who are feeling that pandemic fatigue and just want to connect with friends and family members after this difficult year?
I mean, what I would say is I feel your pain. We are all sick of this. We want to be together. We want to hug our loved ones. We want to have that sense of community and togetherness. What I would say is set your sights on next Christmas. Set your sights on 2021. And just imagine what a joyous Christmas it's going to be, or whatever holiday you celebrate, if everyone you love is still around to celebrate it. If we let our guard down this year, we're going to lose loved ones. We're going to have people who next year we're going to reflect back on those people we've lost. And if we come together as a nation, if we wear our masks, if we socially distance, if this year we say for the holidays we're going to make a phone call or a video connection, we're not getting together, that will have a profound impact on how we make it through this winter and into next year.
Really important message. Dr. Richard Besser. Doctor, thank you very much.
Thanks so much, Elaine.